Good afternoon, everyone. Welcome to the Leadership Development Group's webinar entitled American Healthcare in 2021, What Should Providers, Patients, and Citizens Expect? Being presented by Dr. Kent Bottles. I'm Lisa Clark, Director of Coaching and Operations with the Leadership Development Group. Just a few quick notes before we get started. Please note that all attendees are automatically on mute for the duration of the webinar. We will be taking questions at the end of the webinar. Please feel free to submit your queries through the questions box on the GoToWebinar control panel, and Tara Satlow, VP of Client Solutions, will present them to Dr. Bottles at the end of the call. Additionally, please note that this webinar is being recorded. We will provide a link to the recording to all attendees. We appreciate your attendance and hope that you find this webinar valuable. I will now turn it over to my colleague, Tracy Duberman, President and CEO of the Leadership Development, for a brief introduction.
Thank you, Lisa, very much. And I want to just take a moment to welcome all of you to our final TLD Group webinar for 2020, featuring a topic and a speaker that continues to pique interest. American Healthcare in 2021, What Should Providers, Patients, and Citizens Expect? With Dr. Kent Bottles. Kent is truly one of the most informed and provocative keynote speakers, consultants, and thought leaders in the healthcare industry. He has held numerous leadership positions across our industry, which gives him a unique perspective for being able to view the current challenges through multiple lenses. He is masterfully prepared, thoughtful, and at times irreverent. I know for sure you will leave this webinar feeling smarter, more energized, and better equipped to deal with the pandemic challenges that lie ahead. Kent's been our Sherpa over the past 4 years with the current administration's policy impacts on the healthcare industry, and most recently through the pandemic. January 20th, 2021 is just 49 days away. On this day, we will welcome a new administration, which will bring with it a new style of leadership and new policies. However, they will be facing the same challenges. As leaders in the industry yourselves, you will undoubtedly be facing enormous challenges in the years ahead. The future of work is looking quite different. I encourage you, as you reflect on the past year, to consider what you did well and what you strive to do differently in the year ahead. Within our own practice here at TLD Group, we are seeing a surge of leaders engaging our support for organizational redesign, virtual team development and alignment, building agility and succession planning, especially at the executive level. And they're yielding amazing results. So to this end, as you reflect on the past year and plan for the upcoming one, I welcome you and even encourage you for your own growth and development to reach out to me, our team, for support. And of course, from our families to yours, we wish you a healthy and happy, joyous holiday season. So now on to the headliner. Kent, take it away.
Thank you, Tracy, and it's a pleasure to be here. Here's the agenda for today. First, talk about healthcare under President Biden. First, the fate of the Affordable Care Act. The Supreme Court, as you know, held arguments December 10th. Then how President Biden will approach the coronavirus differently. And then the pandemic in 2021 and beyond. The immediate, the intermediate, and post-pandemic periods. And the immediate period is going to be grim. Yesterday, Robert Redfield, the head of the CDC, said that we are right now in the most significant public health challenge in our nation's history. Yesterday, over 3,000 Americans died of COVID-19, which is a higher death rate than even when New York City experienced their terrible death rate in March. We'll talk about the statistics, talk about long COVID. One of the things that I think you need to really remember is that it's not binary. It's not like that you either die or you recover. A lot of people are now experiencing symptoms and problems months and months after they are no longer infected with COVID. So this long COVID is something that we don't know how many people and we don't know how long it's going to last, but it's something we need to deal with because not everybody that gets COVID recovers. Then we need to talk about the immune system and vaccines, and that's the hope. I mean, it really is hopeful, and it really is an amazing scientific achievement that we now, looks like we have vaccines that are going to work that can be distributed at the end of December and the rest of the year if the FDA approves it. One of the vaccines is going to be looked at on December 10th and the other one on December 17th. We'll then talk about the global effort to deal with this pandemic, because it is a global pandemic. And even if the United States achieves herd immunity through the use of vaccines, we won't be safe if there's still pandemic going on in South America, Africa, Southeast Asia, and other parts of the world. The world is so interconnected now that we really can't say that pandemic is over until we control it everywhere. And we'll end up with how pandemics end, with a little bit of historical context and also a prediction about what's going to happen in the future. Well, here we have a slide about the Affordable Care Act, and you can see that for the first 7 years, it was quite unpopular. The unfavorable in the Kaiser Family Foundation poll clearly was higher than the favorable. And yet around 3 years ago, in March of 2017, it changed. And you can now see that for the last 3 years, the Affordable Care Act is more favorably encountered by the rest of the United States than before. And so now about 55% of Americans view it favorably, and only about 39% view it unfavorably. That's quite a change. So now we have the first polling question to see if you're awake.
Okay. So the Supreme Court heard oral arguments about the ACA right after the election. It looks like all justices will decide to uphold the ACA. All justices will decide to throw out the ACA. 2 conservative judges will join liberals to uphold the ACA. 1 liberal judge joins the conservatives to throw out the ACA, or experts are saying ACA fails without individual mandate. So we'll wait for a few seconds for responses. Okay, I'm closing the poll. Okay, so it looks like 60% believe that 2 conservative judges will join liberals to uphold the ACA, whereas 22% think that all justices will uphold the ACA. 9% saying experts will say that the ACA fails without the individual mandate, and 7% with 1 liberal judge joining conservatives, and 2% saying all judges will decide to throw it out.
Great. Well, the majority is correct. That we're going to talk about that, but it looked like that 2 of the conservative judges didn't buy the arguments. So the ACA has really had an up and down existence, but it's still working, which is kind of amazing if you think about it. This is a chart of the United States from 2014, which shows that most of the country had 2 or 3 options in the exchanges if you were on the ACA exchanges. But throughout the South and the Upper Peninsula of Michigan, there was only 1. So that makes it that it's hard to say that it's being successful if there's areas of the country where there's only 1 insurance plan that you can look at. If you then go to the next year, which is 2018, you can see that it's struggling. And this is probably because President Trump's administration really tried to curtail the ACA. You remember Congress tried to get rid of it, but couldn't. But here, not just in the South, but in lots of places in the Midwest and in the Southwest, there were places that only had 1 insurance plan. And that's because insurance companies weren't sure that they could make money based on it, because of all the changes that were happening and the uncertainty around the ACA. And yet in 2021, we're in the middle of enrollment right now, you can see that almost the entire country has 2 or 3 options, with just a few states. It looks like Alabama is the one big state that doesn't have a lot of options, but the ACA seems to be working, seems to be operating rather well. This slide makes the same point, just that in 2018, 52% of counties in the United States only had 1 insurer, and yet now in 2021, it's only 10% that have 1 insurer. So that's interesting. So why are we talking about the fate of the Affordable Care Act 10 years after it was passed? Well, in 2017, the Republicans passed a tax bill that you've probably heard about. And part of the tax bill they passed eliminated the individual mandate by reducing the penalty to zero. Now, this individual mandate, that was the idea that everyone in the United States had to have health care insurance or else they would get a penalty on their taxes. Now, the individual mandate that was in the ACA was so low that many people didn't think it was as effective as other places like Germany, where they have a high individual mandate. But the idea is obviously that if you have more people involved in healthcare insurance, then those that don't get sick can subsidize those that do get sick. And so basically the Republicans got rid of it. Now, when that happened, 20 Republican states decided to sue, saying that since that part of the ACA was reduced to zero, the entire ACA should be unconstitutional. Most lawyers thought this was a rather weak argument. However, Judge Reed O'Connor of the Federal District Court in Fort Worth, Texas, ruled that yes, the entire ACA was invalid. Now, he stayed making that operational until it was under appeal, and then surprisingly, the U.S. Court of Appeals in New Orleans agreed, but they didn't say that the ACA was unconstitutional. They sent the case back to Judge O'Connor to say, well, does that mean all of it has to be unconstitutional? And that's what was argued before the Supreme Court in December 10th, just a few weeks ago. Now, obviously, they wanted to have that argument after the November election, and they did. It's called California versus Texas. And during the oral arguments, which I listened to, it was quite clear that Chief Justice Roberts and Associate Justice Kavanaugh appeared to argue that just even if you say the individual mandate is unconstitutional, that the rest of the ACA could be severed from that and stand alone. And so they also made it clear that Congress never really intended to get rid of the entire ACA by lowering the tax penalty to zero. So it looks like for now that we don't know. I mean, it's probably going to be till June till the Supreme Court decides finally, but it does not look like the entire ACA will be overturned. Now, the majority of Americans don't want to see the ACA overturned. Would you like to see the Supreme Court overturn the ACA's protections for people with pre-existing conditions? Only 16% of Americans said yes. Would you like to overturn the entire Affordable Care Act? 36% of Americans said yes. So 58% said no, we'd like the Affordable Care Act to continue. This is Judge Reed O'Connor of Fort Worth, Texas. He's a member of the Federalist Society, was appointed by George W. Bush. This is obviously John Roberts, the Chief Justice, and this is Justice Kavanaugh, both of whom are quite conservative, but both of whom in the oral arguments seem to indicate that they were going to uphold the rest of the ACA. So the 60% of the people on the question got it right. Now, if the Supreme Court of the United States had ruled or will rule that the entire ACA is invalid, it would be quite something. 20% of the US economy would be plunged into uncertainty. Remember, the entire healthcare industry has spent the last 10 years accommodating the Affordable Care Act. 21 million Americans would lose their insurance. 133 million Americans with pre-existing conditions would lose their ACA protection. Children could no longer stay on their parents' health care insurance until age 26. And the Commonwealth Foundation has said, you know, it's going to be even worse because we're in the middle of a pandemic where about 14 million Americans have lost their employer health insurance due to the COVID-19 pandemic loss. I was reading yesterday that there's still about 20 million Americans who have lost their jobs due to the pandemic, and about 14 million of them have lost their health care insurance. Now, just to remind you, not to get too much into the weeds about the ACA, but Charles Gaba, who you can follow on Twitter and is quite interesting and really a real expert, talked about the ACA as a three-legged stool, and that the insurance companies had responsibilities, and that's in blue, for things like guaranteed issue and 10 essential health benefits, no annual lifetime benefit caps, very important, maximum out-of-pocket costs, no cost preventative services, and you can stay on your plan until, children can stay on the plan until 26. So that's one leg of the three-legged stool. The red part are what we as enrollees have responsibilities, that we all had to have healthcare insurance. This part is the individual mandate that was eliminated by the Trump tax cut, and that there were a limited time period where you could enroll in it toward the end of the year. And then government had responsibilities about having subsidies for people that couldn't afford insurance. Now, the problem has been that the Trump administration has done everything they could to really dismantle the ACA. They couldn't get Congress to overturn it. They just couldn't get them to vote on it that way. But they've done a lot of things like trying to have plans that don't have the 10 essential health benefits. And obviously they did get rid of the individual mandate. So the idea here is that if you have a three-legged stool and you take out this part of the blue leg and you take out this big part of the red leg and some other parts over here, the stool is going to wobble and not do real well. But we saw that it still is working, and still insurance companies are enrolling people in it. And this is Charles Gaba, who's worth following on Twitter as a real expert on the ins and outs of the Affordable Care Act. Well, President Biden is going to become president next January, and he has indicated that he's going to respond to President Trump, who's restricted two of the ACA's pillars: subsidized coverage for low-income Americans and broader eligibility for Medicaid. During the Trump administration, about 2.3 million Americans have lost coverage, and President Biden has also said that he'd like to have a public option and expand subsidies, but those would require congressional approval. So if the Democrats don't take the two Senate seats in Georgia, there's a special election, I believe it's on January 5th, what can Biden do? Well, having a president that supports the ACA is a big difference than having a president like President Trump, who did everything he could to kind of decrease the ACA around the edges. Biden can expand the length of open enrollment in the 36 states that use the federal ACA exchanges. One of the things Trump did was that he curtailed open enrollment. He also cut by 90% the advertising to get people to sign up. He also, President Trump, took away the funding for navigators. There were navigators that helped people sign up for insurance plans on the exchanges. Biden could also reverse the rulings that favored short-term, non-compliant ACA insurance plans. Now, what that means is that some people said, well, let's have cheaper plans, and Trump made rules that made it easier to have very cheap plans that didn't cover much. Remember, under the ACA, they had to cover 10 different essential benefits. But if you have a really plan that doesn't cover much, the premiums can be quite low, but then it doesn't cover things like pregnancy or lab tests or other things. President Biden could also, by executive order, expand contraceptive coverage. He could not approve Medicaid work requirements. One of the ways that the Trump administration tried to weaken Medicaid was to require people to have work requirements. And he can also discourage consolidation of hospitals. Now, these are the 10 essential health benefits that every ACA plan has to have coverage for: outpatient services, emergency services, hospitalization, maternity care, rehab services, lab services, prescription drugs, mental health, prevention, and pediatric services. And those smaller, shorter plans that were cheaper, that have been encouraged under the Trump administration, didn't have to have all of these plans. So they were cheap, but they didn't cover much. And then people were surprised when they didn't really have health insurance. Biden has also said that he'd like to have a public option. Now, he did not go for Medicare for all that Bernie Sanders was supporting. But the public option that Biden has proposed would compete with the private plans on the ACA exchanges. And many people see this as a transitional step to Medicare for all. Biden has also said he'd like to lower Medicare eligibility age to 60 from 65. He's also is saying that, look, for progressives, it's not what you want in Medicare for all, but it's a compromise. And for conservatives, it's not what they want, but maybe it's a compromise that we can work out. Now, as always, the details are lacking, and we'll have to see what happens. But if you think about it, if you did do having a public option that was in competition with the Aetnas and Cignas and private insurance on the exchanges, that could undercut private plans pricing and result in lower premiums, deductibles, and copays for everyone. Now, there's lots of things going to go on, and I don't think anybody can predict what's going to happen with a new administration. We still don't know who's going to control the Senate, for example. But Mike Leavitt, who was governor of Utah, and then in Republican administrations, Secretary of the EPA and then Secretary of Health and Human Services, is really someone that's, from a Republican point of view, is quite savvy about what might happen. And his election perspectives are that it's rational but not certain to assume that there'll be a Democratic administration and a divided Congress if one of the two Republican senators retain their seat in Georgia. The Biden Transition Organization is well prepared, but will be limited by Trump's lack of cooperation. Most pundits have said that Biden has done a good job in moving forward in kind of a difficult time. The 2022 election cycle is now underway already, and the burden of performance will now shift to the Democrats on the pandemic and the economy. There's nothing more reliable in politics than overreach by a party returning to power. And I think 5 is really interesting. The next 2 years will either be a period of gridlock or a time of historic legislative productivity. Gridlock if the Republicans control the Senate and they continue not to want to compromise. Historic legislative productivity, you really have to go back to LBJ to see a president that understands the Senate and the Congress as well as Joe Biden. Joe Biden, as everyone knows, was a long-term senator, was vice president, and if anybody can sort of block the gridlock and get something done, it probably would be someone like President-elect Biden. Biden will clearly use his executive authority extensively to reverse all the Trump administration actions. We'll talk about that. And also interesting, number 7, soul of the party fights will occur in both parties. I think you're going to see a lot of Republicans versus Trump, and I think you're going to see a lot of tension between the Bernie Sanders wing of the Democratic Party and the Joe Biden wing, which is much more in the middle of the road. And then election reform will obviously be an ongoing debate. So here is Governor Mike Leavitt, who I think has good advice for us. And we're now in the lame duck transition right now. And as you know, we've had 3 COVID relief bills. And right now, there's a lot of talk about having another one. A bipartisan group of senators has actually proposed about a $900 billion relief package. It's not at all clear if that's going to pass, but we really do need some relief because of the economic pressures that are being done to all Americans based on the pandemic. The new Congress will start in January 3rd, and obviously the inauguration is on January 20th. So again, here's what Mike Leavitt thinks that the Biden healthcare priorities will be: improve COVID management, which we'll talk about, reduce disparities in healthcare and health, restore the Affordable Care Act as much as he can, and improve affordability of care and coverage. So basically, I think you're going to see things we've alluded to. Biden can restore navigator funding for the exchanges. He can constrain non-compliant plans, make sure all plans have those 10 essential health benefits. The 1332 waivers are the way that the Republicans have curtailed Medicaid in some states by having workload environments. He can defend the ACA. He can expand the marketplace enrollment and increase subsidies for people and fix the family glitch. He's obviously going to be against work requirements and encourage Medicaid expansion. Not all states have expanded Medicaid yet. Most have. He's also going to work to try to reduce drug costs. Here's a PricewaterhouseCoopers plan that I think is interesting. They talk about adding the public option really has a low likelihood of gaining traction. Increasing tax premiums for families on the exchanges, it probably will get through. Stop surprise billing is moderate. I'm surprised that we have not had action on surprise billing. Limit market concentration, moderate. Allow negotiation of Medicare drug prices. They don't think that's going to get through. Limit drug launch prices, maybe get it through. Allow drug importation from Canada, probably not. Ramp up COVID pandemic response, I think that's going to happen. And onshore production of critical medical supplies and pharmaceuticals. The idea of having a supply chain for PPEs that is more in the United States than coming from overseas. Biden, when he first was said to have won the election, identified a coronavirus task force right away. And it really is an A-team of experts with some problems. David Kessler is a former FDA commissioner and chancellor at UCSF. Dr. Nunez Smith is an associate dean for health equity research at Yale. The former Surgeon General's on it. Rick Bright, who was the BARDA director, that's the part of HHS that does vaccines and was fired by the Trump administration, is on this, as is Zeke Emanuel, Atal Gawande, well-known people. Michael Osterholm is one of the experts in vaccines from the University of Minnesota. Perhaps you've seen him on CNN or MSNBC. He's quite blunt about how we've mismanaged the pandemic and how grim things look for the next 3 months. So it's a good group of people on the response. And what they've already said they want to do is have access to regular, reliable, and free COVID-19 testing. This is a real problem. Even now in December, we don't have enough tests. I can tell you in Pennsylvania right here, my friends that are still seeing patients or identifying patients that clearly probably have COVID, and they're being told that the next appointment for a test is 4 or 5 days away, and the turnaround time from that test is another 3 or 4 days. That makes the test almost useless. One of the things Tony Fauci has talked about that I agree with is that we need to flood the zone with inexpensive tests that aren't quite as accurate as a PCR test, but can be used over and over again. And that would be a way to really try to get a handle on this community spread that we're going to talk about, which makes it so difficult. So we really need to fix the testing problem, increase the supply of personal protective equipment, evidence-based guidance on how communities should navigate, equitable distribution of treatments and vaccines. We know that, I think it was just yesterday, the CDC identified people in group 1A, that the first people to get the vaccine will be frontline healthcare workers and workers and residents of nursing homes. We need to have increased protections for older and high-risk Americans, new defenses for predicting, preventing, and mitigating pandemic threats. This is not the last pandemic we're going to see. We're going to see more pandemics in the future, and a mask mandate would be quite useful. One of the things that I get upset about is that one of the University of Washington modeling people have said that if everybody in the United States wore a mask between now and February, we could save 130,000 lives. 130,000 lives. That's a lot, and it's just mind-boggling to me that we can't get people to wear a mask. So let's focus. Clearly, President Biden is going to be a successful president or a failure as president on how he deals with the pandemic. It's going to be the biggest healthcare story of 2021. I think it's important to recognize that even with the great news of the vaccine, what we're going to talk about, that there's different periods. The immediate pandemic period is really going to last until 2022. If everything goes well, if everything goes right, we might be able to achieve herd immunity in the United States by the end of 2021. But even then, we're not going to be able to achieve it in South America, Africa, Southeast Asia, and other places. So as long as there's pandemic in the rest of the world, we're not really safe. The intermediate pandemic period is estimated between 2022 and 2024. That's when we kind of get control of it. And yet we're still dealing with the economic, the psychological, and the psychic issues around the pandemic. And the post-pandemic period probably won't be till 2024 and onward. So even though we're all tired of the pandemic, as people say, the virus is not tired of infecting us. So why was this pandemic so disastrous? Well, one is globalization, mass migrations. We now have such huge, densely packed cities, it's really hard to control a pandemic. Climate change clearly is affecting it. Encroachment of land with animals who have novel viruses. And then the lack in the United States of a federal government leadership and control and coordination. The World Economic Forum has taken a look at this, and the greatest concerns for the world are a prolonged recession of the global economy, high levels of structural unemployment, especially among the youth. If you're someone graduating from high school or graduating from college, it's very difficult to get a job during a pandemic. And it's been shown that if you have a hard time getting your first job, it really affects your earning power for the rest of your life. Another global outbreak of COVID-19 or a different infectious disease. Coronaviruses are not the only viruses that are out there. Ebola is another one. There's probably lots of viruses we haven't even identified yet. Weakening of fiscal positions in major economies, failure of industries or sectors in certain countries, lots of bankruptcies, and then tighter restrictions on cross-border movement of people and goods. One of the things I don't want to dwell on, but it's hard to overestimate how much healthcare workers are really having a hard time. PTSD among healthcare workers, suicide, and burnout are really, really up in the United States. As someone who's married to a practicing physician and who has lots of friends in the Philadelphia area who are practicing physicians, I can tell you that physicians and nurses and healthcare workers are burnt out, are discouraged, and are very, very disappointed in their fellow citizens because they feel like that they're every day putting their lives and their families' lives on the line by taking care of patients, and the rest of the population can't just observe a travel ban, can't wear masks, can't avoid going to bars. It's very discouraging when you feel like your own life is at risk and people are not doing things that could be helpful. And I can tell you that in the next 3 months, it's going to be the worst time of anybody's life in terms of what's going to happen. This article in the New York Times talked about people that 16,000 practices are closing. Primary Care Collaborative says 20% of primary care doctors are going to early retirement. And this, the president of the AMA, a lot of physicians were hanging on by a thread from burnout before the pandemic even started. There clearly are high levels of stress leading to PTSD and frustration with the public who will not wear a mask. MDs and RNs last week struck at Tacoma General Hospital for more PPE and for the public to follow the guidance to try to control the pandemic. So one of the problems we have is a healthcare workforce that is really at the end of their rope. Now, pandemics have far-reaching consequences that I don't think we've even begun to scratch the surface of what's going on. Just to give you some ideas, seismologists have noted that during the time in the spring when the countries were on lockdown, the Earth was incredibly still. The seismologists were able to register that the movement of the Earth was quite different because people were not going to work. Goats, crocodiles, leopards, and elephants are wandering around cities. Air pollution has decreased. In a city in India, people could see the Himalaya mountains for the first time in decades. The United States has had a K-shaped economic recovery. What that means is that Wall Street is going to record levels, and yet Main Street, lots of small businesses are closing and people are out of work and people are food lines. It's just so depressing to see on the news 6-mile food lines in Dallas, Texas, because people don't have enough food to eat. We've also identified problems in healthcare, a realization that the government needs to provide a safety net. Even very conservative people are coming around to the idea, and an increased support for things like universal basic income that once were very far-fetched. This is something that's really interesting. Year-over-year percent change in personal consumption expenditures on healthcare services. You can see that since 1960, it's gone up and down, but here's the pandemic. It went down over 30%. And now it's back up to where it's only down 2%. But this means that we're not having health care for people with heart attacks, people with cancer, that a lot of elective things are not being done. So I think it's also important to realize, and Tracy mentioned this in the introduction, work is never going to be the same after this pandemic. If you think about Manhattan, all those restaurants that have people that are supported by people having lunch, all those office buildings, now we realize that some workers can work from home. I think you're going to see big changes in commercial real estate and in taxi drivers and everything else in major cities. So ideas that were once on the fringe and that people really laughed at are now becoming mainstream. Kay Raworth is a UK professor who has an idea of donut economics that Amsterdam has adopted, and we'll see a slide of that. Mariana Mazzucato has really become an interesting economist that many countries are looking to. She says we define economic growth way too narrowly, that the greatest achievements in the past have stemmed from government investments like the internet, that GDP is inherently flawed as a way to measure economic progress. And in Wales, there's a future generations commissioner that has to take into account the impact of new programs on the not yet born. And in New Zealand, there's a well-being budget that separates environmental and social costs from benefits, values, households, and volunteer work, and adjusts for inequality. So they asked this economist what she thought would be in 2023. I think she's being a little bit optimistic, saying we'll have COVID under control. But her idea is that we should have a recovery process that doesn't go back to the economics of the past, but goes to a new world, which is greener, more inclusive, and more sustainable. She really thinks that government bailouts should be conditional on maintaining jobs, securing minimum wage, halting stock buybacks, putting workers on governing boards, and has noted that healthcare is notoriously inequitable. I think it's incumbent upon Congress during this lame duck to pass another COVID relief bill because so many Americans are hurting and out of work and unable to afford food. This is Kate Raworth, who came up with the donut theory, and this is Mariana Mazzucato, who's the liberal economist. This is the donut theory of Raworth, and Amsterdam has adopted this to guide their economics. And basically what it says is that you need water, food, health, education, peace, housing, networks, but that just unlimited growth, which we've always thought was good, is not good, because if you overshoot with growth, you get pollution, climate change, ozone layer depletion. And so there's a donut, there's a safe and equitable place for your economy. So it's basically saying that the economy should not just be for growth, it should be for a safe and just space that's greener for humanity to live in. Here's the Himalaya Mountains, which a city in India can see for the first time. Here's fascinating, go on YouTube. I've spent hours looking at lots of videos of wild animals in cities. These appear to be foxes. Here's some goats roaming a street. And here's an important chart. I think that we're really having a lot of fatigue, and we're having problems with lockdowns. We're having problems with not going to restaurants and bars. But this is a study from the great influenza of 1918. And I've shown this before, but it's such an important study because we've made a false choice. The choice we've had is to either let the COVID infection go wild or to shut down the economy. And most people think that that's the wrong question to ask, that you really can't have economic growth until you control the virus. And as you all know, that in 1918, there was a huge pandemic of flu. And in this study between 1914 and 1919, they looked at the change in employment on this axis. So obviously, 120% increase in employment is good, and lower increases are bad. On this axis, you have mortality per 100,000 people. So more people die over here, less people die over here. So you'd like to be up here. And what this study shows is that cities with measures such as distancing, wearing a mask, enforced for more days than the average cities are in green. Cities with distancing measures enforced for fewer days were in red. That cities that did the lockdowns, that did the social distancing, that wore the mask, got control of the virus. Seattle, Oakland, Portland, Los Angeles did better, both in mortality rate and in employment coming back after the pandemic subsided. Cities like Philadelphia, where I live, Pittsburgh, did worse. So this, I think, is really evidence that we should be willing to bite the bullet, control the virus until the vaccines come, and the economy will then bounce back. Could we have the second polling question, please?
Of course, here we go. So we have learned during the pandemic that scrubbing surfaces is the key to controlling viral spread. Mutations in the virus have made it more deadly. The virus cannot spread more than 6 feet in the air. More Americans are dying now than in the spring, and ventilation is key to preventing spread of the virus. We'll give it a few moments while people log their answers. Okay, I'm going to close the poll. And it seems that the most popular answer is more Americans are dying now than in the spring, with 71%.
How many people said ventilation?
So ventilation was 25% of the answers.
So those are the two questions. Those are the two answers I probably would have said ventilation. And we'll show a slide that, although I don't disagree that you're saying that things are really bad now compared to the spring. But one of the things that we haven't really talked enough about is ventilation, is that it looks now like that when people have these super spreader events, they're mostly inside and they're mostly places that aren't ventilated. There's been a couple of apartment buildings where the ventilation has spread the virus. So for example, Dr. Fauci says if you have to drive in the car with other people, always have a couple windows cracked so you have ventilation. That people have talked about in schools, make sure that you open windows or have adequate ventilation, because that cuts down the spread of the virus. So that's great. So here we are today, and this is why I'm so depressed. We have basically an emergency in almost every state. On this slide of the United States from the New York Times, the darker the color, the more cases per 100,000 people in the last week. We have just a huge outbreak in the Midwest, Ohio, parts of Nevada, parts of Texas. It's just everywhere. And this makes it really, really hard to control because of travel and because of so much community spread. So I looked up this morning before we came on. Today, 14 million Americans have tested positive. Almost 280,000 Americans have died of the virus. Globally, 64 million people have been positive and 1.5 million are dead. And the scary part is that these numbers are clearly underestimates, because the excess death studies show that we're really only counting deaths in the hospital and confirmed cases, and there's all sorts of uncounted deaths, chronic illnesses, asymptomatic people. So that it really, those numbers are low numbers. So here's a slide we have to spend a little bit of time on that really is quite depressing. In the red is new reported cases by day, 7-day averages. And down here is deaths by day. So back here in April and May, this is New York, Connecticut, and New Jersey. This is that terrible peak right in April and May. And you can see here that new cases per day were about 40,000. We then brought it down, but we never brought it down to lower than 20,000. And this is the uptick in cases in Florida, Texas, Arizona, the Sun Belt in July and August, okay? And then we brought it down, but didn't even bring it down to 20,000, brought it down to an average of about 45,000. And here we are now with this going up now. This is where we are today. This little decrease here is just an aberration because we have trouble counting the cases when there's a holiday. Thursday was Thanksgiving. So it's going way up. Now, the other thing that's a little subtle is this slope here is much gentler than this slope here. We're increasing cases much more rapidly than we were back there. So this is the worst time in our history. This is the worst time in this pandemic right now. Now, in New York City in April and May, and in New Jersey, we got to a little over 2,000 deaths a day. And you can see here that the death rate has now gone down, although it went back up when we had the cases in the Sun Belt. And you can see here there's a little lag. Deaths happen a little bit 2 to 3 weeks after the increase in cases. We then only brought it down to about 50,000 cases a day. And now, yesterday, we had over 3,000 deaths in one day. And that's actually more than we had back in April and May. So this is going to continue to go up exponentially. And that is really bad. I mean, we're going to have so many cases that one model says that by March 1st, we'll have 500,000 Americans dead. And the really sad part is most of those Americans didn't need to die if we had all worn a mask, all used social distancing, all washed our hands and not touched our face, all avoided being inside in crowded places, all avoided places that weren't ventilated, and avoided travel that wasn't necessary. So this is rather grim, and I agree with Dr. Redfield, who says right now we are in the most significant healthcare challenge of our nation's history. Now, we've done better in some ways. This is back in March. The length of stay for patients was 10.5 days. We now know better how to take care of patients, and the length of stay in the hospital is only 4.5 days. So we've learned something. Back here, we knew very little about the disease at all. And this is important too, because our care has changed. In March, 18% of people that presented to the hospital with COVID were put on ventilators. We now know that we can successfully manage them with only 2% on ventilators. We've learned that if people are prone, they do much better than if people are lying on their backs. We've learned that for people with really serious disease, this in the turquoise here, that if you use dexamethasone, which is a steroid, for very serious disease, it can be quite useful. So now we're using more of that. Patient mortality has gone down because we know better how to take care of it. 11% back in March, it's now down to about 3.7% now. Part of that also is probably because younger patients are being infected. So younger patients don't do as poorly as older patients. It's clearly the older you are, the more likely you are to die. Patients are presenting to the hospital earlier. Perhaps the fact that some people are wearing masks has reduced the viral load, and we have some treatments. The only treatments we really have now are the Regeneron and Eli Lilly monoclonal antibodies that President Trump, when he got sick, got the Regeneron. Chris Christie, the former governor of New Jersey, got the Eli Lilly monoclonal antibody. Remdesivir, if given early on, seems to help a little bit. It's clearly not a game changer. It only cuts down the hospitalization length by a little bit. But dexamethasone in patients with severe COVID in the hospital has been quite useful. This is really important that we now understand the disease much better, and it comes in phases. The first phase is the incubation phase, and where asymptomatic people are mildly symptomatic. And one of the reasons why this is such a devastating disease is asymptomatic people can spread the disease. They have no symptoms, they don't know they have the disease, and they can spread the disease for 3 or 4 days. The second phase is the interstitial pneumonia, which is the pulmonary phase. We used to think that was all there was. We now know that that's not true. There's a pro-inflammatory phase. So phase 1 and 2 are due to the virus, the viral infection of the patient. Phase 3 is really due to the immune response of the patient. It's an overreaction of the immune response. So it's kind of like an autoimmune disease. And then some people in phase 4 have a prothrombolytic phase. And that's where you get thrombosis, which just means blood clots. And those can flip off and cause a heart attack or a stroke or an amputation of a leg. Now, this final outcome, I disagree with this chart because we have remission, we have some deaths. There should be another arrow here for chronic COVID or long haulers. Now, down here for the management, here is where you give remdesivir early on. Here is where you give monoclonal antibodies. Convalescent plasma, we have a study now that says it doesn't work. So basically the anti-inflammatory drugs, the dexamethasone would be given out here, and anticoagulation therapy would be given for phase 4. Now, this Swiss cheese respiratory virus pandemic defense, I think, is one way to think about how to protect yourself and your family. You have the little viral particles here, and you have things that you can do yourself. You can physically distance and stay home. You can wear a mask. You can wash your hands whenever you go out. You can avoid touching your face. You can not go indoors. It's much more likely to get the virus inside than outside. There's also things that we have shared responsibility. We should do more testing. Ventilation is very important. Having things outside is better than having things inside. Government messaging should be consistent, which it hasn't been. And we should have quarantine and isolation and then vaccines. And what this Swiss cheese model says is that each intervention and layer has imperfections or holes, but if you stack them up, you can avoid getting the virus to the person over here. So SARS-CoV-2 is the Goldilocks virus. It's just bad enough in every way. Symptoms can be severe enough to kill, but mild enough to move undetected. They spread quickly enough to overwhelm hospitals, but slowly enough that stats don't spike until it's too late. And right now, it's too late. The hospital systems in America are going to be overwhelmed. It's more contagious than the flu, but less contagious than measles. It's deadly, but not too deadly. It can cause mild disease or severe disease that lingers. And the big thing is that asymptomatic patients are infectious. Now, we've learned a couple of things just in the last couple of weeks that we didn't know before. One is that it looks like that the COVID-19 virus came from China and was in the United States in December of last year. And the reason we know that is that they've looked at blood donations in December and found positive antibodies to the COVID-19 virus in Washington State, Oregon, and California. The other thing we now know that was first thought to be very skeptical was that it has mutated and made the virus easier to spread. Now, the mutations have not made people sicker or killed more people, but this one mutation, 614G, was seen in China in January, and it was not the mutation that got people sick in Wuhan. But the outbreaks in UK grew faster with this mutation of the coronavirus than the Wuhan strain. And they've now done experiments in hamsters and infected human bronchial tissue. And we're now finding that is true, that this mutation has occurred and it allows the virus to clamp on much more tightly to that ACE2 receptor, which is in the human body, which is how the virus gets into the cell. So here in January and February, Wuhan in the purple, that's the Wuhan virus. And you can see just a tiny yellow 614 G mutation. The spread to South Korea and Japan was all the original virus and mostly to Australia. But look, to Italy, it wasn't, the virus had mutated in this one spot, 614G. And if you look in March, you have 72% of the virus being the 614G mutation in the United Kingdom, 62%. And then in June, you can see that now the 614 mutation really is the one that's spreading throughout the world. So that's an interesting thing. Virologists were very skeptical to believe that at first, but now they do believe it. One thing we've emphasized is it's not just that you either get well or you die. There are now these things called long haulers COVID or long-term COVID. 87% of people in Italy who recovered have symptoms months later. 79% of Germans had heart damage. Lots of studies. And what this is that multiple lungs, multiple organs, not just the lungs, have been affected. Lungs, heart, brain, causing COVID fog, headaches, mood swings, peripheral nervous system problems, blood clots can cause MIs, strokes, and pulmonary emboli. Now, it looks like that myalgic encephalomyelitis, or chronic fatigue syndrome, shares many things with long COVID. Chronic fatigue syndrome can be triggered by other viral infections, and now we're wondering whether these long COVID patients really have chronic fatigue syndrome. They have brain fog, post-exercise decline, muscle pain, autonomic nervous system problems with their blood pressure and their pulse. Sitting up is really, really difficult. It's called postural orthostatic tachycardia, where your heart goes crazy, and you need 6 months to make the diagnosis. Okay, so the one good thing that's going on is vaccines. That it now looks like that we have at least 2, and probably by the first of the year, we may have as many as 4 vaccines that can be used in the United States. So Ed Yong has written some really good articles in The Atlantic, and he did a nice job of talking about the immune system, which is how the vaccines work. The immune system is a network of cells and molecules that protect us. They detect a threat, they summon help, they counterattack. There's an innate immune system, which is really quick and primitive and generic. There's an adaptive immune system, which is what we're talking about with a vaccine. It's slower, but it's more precise, and it's long lasting and has memory. So the immune system causes inflammation and can damage the body as well as to destroy the pathogen. Really important point. The virus comes in, the immune system reacts, the immune system tries to control the virus, but all the inflammation to control the virus is what's attacking the lungs and hearts and brains of people. This is Ed Yong, who really has written some wonderful articles in The Atlantic. So there's different groups of cells and molecules for different types of pathogens. Viruses and microbes that infect cells, they get a different immune response than bacteria and fungi that stay outside cells. Parasitic worms have a different immune response. What's interesting in COVID-19 is that all 3 are activated. And as one researcher said, the immune system almost seems confused as to what it's supposed to be making in terms of white blood cells and cytokines. So here's some cells. This is a T cell. This is a B cell. These are kinds of lymphocytes. These are just red cells, red blood cells here. And the T cells and B cells are the main cells of the immune system. That is how the vaccines work. Here's a T cell here on electron microscopy. Here's a plasma cell. A plasma cell is a special type of B lymphocyte, and that's what makes antibodies. And vaccines make antibodies to the coronavirus, and that's how we can achieve herd immunity. So antibodies are Y-shaped proteins that the body makes. They're produced by B lymphocytes called plasma cells. They attach to the pathogen, the virus surface, to kill or prevent the pathogen from entering the cells. And they also signal a whole bunch of processes via T cells that clear pathogens and protect the body. So here is a viral particle with its spike protein. So this is the coronavirus with its spike protein. And that spike protein is why it's called coronavirus, because it resembles a crown. Here's a Y-shaped protein, the antibody, which is going to attach to that spike protein and eliminate the virus. That's how both the immune response in infection works. That's also how vaccines work. So we've discovered that the spike protein on the surface of coronavirus is a really good target for vaccines. The Russians and the Chinese are using inactivated virus vaccines. And then there's 2 different kinds of vaccines that you've heard about. There's the vector vaccines, which use an adenovirus or a chimp cold virus, so a benign virus to get something into the cell. And that's the J&J vaccine and the Oxford AstraZeneca vaccine. You've heard about the AstraZeneca vaccine has actually reported some results out. And then you have a brand new way of making a vaccine that's never been done before, which is the Moderna and Pfizer vaccines. Now, it's important to realize that these are the first two vaccines that have ever been done using this new platform, the so-called RNA or messenger RNA vaccine platform. That's the Moderna and the Pfizer vaccine. Now, the fact that we have a vaccine that is probably going to be approved for emergency use in a few weeks is amazing. In the past, the mumps vaccine took 4 years to develop. We've developed this vaccine in less than a year. Now, you have to be careful with vaccines because some vaccines in the past against SARS, HIV, and dengue fever actually had what's called antibody-dependent enhancement that made people sicker. It didn't protect people from the viral infection, it made them sicker. There's never been an HIV vaccine after decades of attempts. And one thing is that the United States has done is invested in Pfizer, Moderna, Oxford, Merck, and J&J. They've been starting to produce vaccines even before they know if it will work. So what we now know is that we've heard about the Pfizer vaccine and the Moderna vaccine. And why have we heard about that? Because there's different phases of trials they have to make. And we've just heard the results of the phase 3 trials from Pfizer, Moderna, and AstraZeneca. So Pfizer has tested out their vaccine in 43,000 patients. Half of them got the vaccine, half of them did not get the vaccine. The 43,000 patients were in places with a lot of viral activity: Brazil, United States, the UK. So they gave the vaccine to half the people, they gave the placebo to the other half. You don't know which one you got. And they've now reported on 170 cases in the Pfizer vaccine, which is a messenger RNA vaccine. And of those 170 cases of coronavirus, 162 were people that got the placebo, were not protected. Only 8 were in people that got the vaccine, so most of them were protected. And there were 10 serious cases, and only one of those serious cases was in a patient that got vaccinated. So that shows you that they say that it's about 95% effective. Now, the Moderna vaccine is a different company, but a similar platform of a messenger RNA vaccine. And they have now reported out 185 cases of the virus infection. They had about 30,000 participants in theirs. So half got the vaccine, half were a placebo group. 185 cases in the placebo group, 30 of which were severe, very serious cases. Only 11 cases in the vaccinated group, and none of the 11 cases that got coronavirus in the vaccinated group were severe. Great news. So it sounds like that both the Pfizer and the Moderna vaccine have about a 95% efficacy rate, which is really much higher than we expected. Now, one of the problems is the Pfizer vaccine has to be stored at minus 70 degrees Celsius, and that's really cold, and it's not like a regular freezer. The Moderna vaccine can survive at minus 20 degrees Celsius. The Oxford AstraZeneca vaccine, which doesn't seem to be quite as good, can just be refrigerated. So those are things that you have to think about. Now, one of the things that we worry about is, in order to stop this terrible pandemic, we have to get to herd immunity. That means so many people have antibodies to the virus that it can't spread. There can't be community spread. But we can't get to herd immunity if people don't take the vaccine. And there's a lot of distrust and mistrust in terms of the vaccine. This just shows you in mid-August, white Americans in August, 70% said they'd take it. But by October, that went down to about 59%. African Americans in August, 65% said they'd take it. African Americans by October, only about 42% said they'd take it. So the problem is that we need to have people take the vaccine if we're going to have the ability to control the virus through herd immunity. Now, it is hard to overestimate how fantastic this development is. It's amazing that this brand new messenger RNA platform works. It's amazing that it works and that we got it done in a year. However, even though we're saying it looks like we can get America vaccinated in 2021, and that perhaps we'll be able to get the regular general population to get the vaccine by June or July or August, there are still a lot of hurdles to overcome. The Operation Warp Speed is talking about a 24 to 48 hour rollout, but it's not just a logistical challenge. This mistrust is a big deal. States have said they need $8.4 billion to vaccinate everybody. They've only received $340 million from the federal government. Overcoming this distrust is big. We haven't tested the vaccines in pregnant women or children. We don't know if you have the vaccine, if you are protected from getting disease, but if you do get the disease and you've been vaccinated, can you still spread it to other people? You could still have manufacturing glitches where the vaccine wouldn't be coming out. Now, the CDC did meet yesterday, and they did say that the first tranche of vaccines will be given to healthcare workers who are taking care of patients and workers and residents of nursing homes. Nursing homes, because 6% of American cases have been in nursing homes, but 40% of the deaths, we've said there have been over 280,000 deaths in America, 40% of those deaths are in nursing homes. So that's why they're getting the vaccine the first. Can we have the last polling question, and then we can wrap up?
Sure. Okay. So on the topic of Bill Gates, 44% of GOP says vaccines implant chips in people. He has only raised money for the vaccine effort, has expertise in epidemiology, only recently got involved in vaccines, or has been a key Trump advisor. We'll give that a few moments while everybody votes. Okay, I'm going to close the poll. All right, so there's a split here. 36% say that Bill Gates has only raised money for the vaccine effort, while 27% say that 44% of GOP says vaccines implant chips in people, and 22% say that only recently got involved in vaccines.
So the right answer is that 44% of Republicans in America believe that Bill Gates is only advocating for vaccines because he wants to make money and he wants to implant chips in all Americans and track them. This is, to me, rather shocking in the sense that it's not true, it's disinformation, and it shows you that one of the things that we've been battling in this pandemic is the social media ability to have misinformation travel all over the place and really affect us. So it turns out that the Bill and Melinda Gates Foundation has actually nominated themselves to be in charge of the global vaccination program. The foundation has given over $11 billion to get vaccines to 150 nations. Long before the pandemic, years ago, the Gates Foundation created two nonprofits, Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovations. Gavi is in Zurich, Switzerland, where the WHO is, and the Coalition for Epidemic Preparedness is in Norway, I believe. Bill and Melinda Gates put $55 million into BioNTech, and that's the German company that created the messenger RNA that Pfizer is using. So this was in 2019, before the pandemic. Bill Gates, since the 1990s, has been really interested in vaccines and been warning us that a pandemic might be on the way and that we needed to prepare. COVAX is the name of the effort headed up by the WHO, the World Health Organization, and the Gates Foundation. And basically what Gates has been doing is he's been in charge of the whole thing, raising money, because he can call up any pharmaceutical company and any president of any nation and get through to them. And so one of the people that used to work at the WHO said, some people will say, why should it be him? He has the star power, he has the resources, he cares. There are many people that do things, but not at the scale of Gates. And this is the guy that said that. This is Dr. Pablo Mendez, who used to work for the WHO. Here's Bill and Melinda Gates, whose foundation is worth $55 billion. They've invested $11 billion in trying to get everybody vaccinated. Now, there's been a lot of criticism of the Gates approach. India and South Africa want to suspend global enforcement of intellectual property rights. The current plan is that poor countries they'll only get about 20% of the vaccine they need by the end of 2021, while we're saying that perhaps we can vaccinate all of America by the end of 2021. Some models show that it really won't be until 2024 for enough vaccines to be able to be used worldwide. And people like Brooke Baker, a law professor, says the consequences of long-time Gates strategies is that they go along with corporate control over supply. In a pandemic, that's a real problem. So he's saying that we shouldn't rely on pharmaceutical companies. We should do it outside of pharmaceutical companies. And Amr Atian, who's a University of Ottawa professor of law and medicine, says the Gates Foundation presence has been at best an adjunct to the WHO and at worst a hostile takeover and usurpation. There's a lot of tension between the WHO and the Gates Foundation, and yet since the Gates Foundation is giving them so much money, he's been able to take control. The people at WHO would like to be in charge of vaccinations, and yet Gates says they don't really know what they're doing. So it's an interesting thing. Here is the law professor Brooke Baker, who's been critical of Gates, and this is the law professor Amr Atian from University of Ottawa. So as we've seen, there's a lot of conspiracy theories out there that the Gates Foundation has killed thousands of children in Africa and India testing vaccines. That's false. That Gates wants to depopulate the world. That's false. And 44% of Americans who are Republicans believe the immunization effort is a cover for Gates to implant microchips and track people and make money. Here you have some people with a picture of Bill Gates with his usual pastel sweater and a syringe. Your body, my choice. Say no to Bill Gates, and vaccines can cause injury and death. But what has Gates done is that he actually has raised a lot of money. He's gone to Britain, the European Union, China, and raised money to get vaccinations for poor countries. He asked for $8 billion from the United States, but was told no by the Trump administration. And Trump has withdrawn from the WHO support, and Trump has not participated in the global discussions about how to get vaccinations to everybody in the world. What they've come up with is that companies could charge all countries the same price, or they could set tiered prices for low, middle, and high-income nations. The price will not be more than $21 per dose, and they've now said that low-income countries can pay $1.60 or $2 per dose, which is still a lot of money for a low-income nation. Dr. Seth Berkley, who's in charge of GAVA, which is the not-for-profit that Gates founded, has said, did we communicate with everybody as well as we could? No. Have we brought together the entire world to discuss equitable access to vaccines? Have we raised substantial amounts of funds? All of that's true. And Bill Gates responded to the criticism by saying, this capitalist thing, there actually are some domains that actually works in. North Korea doesn't have that many vaccines. This is Dr. Seth Berkley, who runs the GAVA, which is the Vaccine Alliance. Now, it's really interesting that the Pfizer vaccine is based on a BioNTech company, which is founded by Dr. Ugar Savan and his wife, Dr. Özlem Türeci. They're both Turks, and they both live in Germany, and they were focused on cancer therapy using a messenger RNA technology. 2 years ago, before the pandemic, Dr. Sahan predicted his company could rapidly develop a vaccine in event of a global pandemic. Starting in January, he and his wife did it. And here they are, Dr. Sahan and Dr. Türeci. And the way that both the Moderna and the Pfizer BioNTech vaccines are messenger RNA vaccines. It's a brand new way, never been used before for any successful vaccines. And now people think it's going to be a platform where we can rapidly develop vaccinations for any new viral pandemics that occur. The way it works is the RNA vaccines work by introducing a messenger RNA sequence, which is coded for the coronavirus spike protein. That means it has the recipe to make the spike protein. Now, the viral particle has 25 different proteins. This just makes one. So you stick that into a human cell, and the human cell then starts cranking out spike protein. That spike protein antigen is recognized and creates the immune response. RNA vaccines are faster and cheaper than traditional vaccines, which are usually attenuated virus vaccines. It's laboratory based, and so you can scale it up, but there's still a lot of work to be done. We don't know how long the immunity is going to last. We really don't know a lot about their potential side effects. Now, the UK yesterday approved for emergency use the Pfizer vaccine, and I've been able to read the insert on the vaccination that goes to the pharmacies, and it looks like that there probably are more side effects in terms of local pain, fever, malaise, fatigue. So there may be some local side effects that I hope don't discourage people from taking it. So how do pandemics end? If you look at historians like Alan Brandt, as we've seen in the debate over the opening of the economy, many questions about the so-called end are determined not by medical and public health data, but by social political processes. So pandemics historically have had two types of endings: medical, where the incidence and death rates decline, and social, where fear of the disease wanes. Smallpox has achieved medical end. We've gotten rid of smallpox around the world in the 1980s, but it's been the exception because there's an effective vaccine that gives lifelong protection. For the coronavirus, we don't know if there's lifelong protection. That virus had no animal host. The infection was obvious, and there was no asymptomatic spread. So COVID-19 may be ending socially, and I'm afraid that's what's happening right now before medically. I think there's a sort of social psychological issue of exhaustion and frustration. We may be at a moment when people are just saying, that's enough. I deserve to be able to return to my regular life. I'm going to travel. I'm not going to wear a mask. I'm going to go out to bars. The medical end would be when we achieve herd immunity either by infection or vaccination, where 70% of Americans and then eventually 70% of all the world has herd immunity. The problem is you can have the pandemic end for some people, but not end for other people. The elderly, the chronically ill, the poor, the imprisoned, the socially marginalized. The SARS-2 pandemic will continue to be a threat long after the majority has moved on psychologically and practically, and long after overall levels of the virus are low. It would be a tragedy, I think, if we have a social end to the pandemic now in the United States, because a lot more people are going to die in the next few months that don't necessarily need to die. And that is all we have for now, and I'd love to open it up for questions. We have 12 minutes for questions, and we'll also send out written responses to questions we don't get to.
Excellent. Thank you, Kent. So well done. I do have some questions for you. The first, how will telemedicine affect medical care as well as physician and hospital system revenue?
Telemedicine obviously took off. My wife stopped going to the office and did medicine for 3 or 4 months out of our bedroom. And I can tell you that my wife's department of OBGYN here in Philadelphia is trying to convert 20% at first of all their outpatient visits for OBGYN to telemedicine visits. So, and if you look at telemedicine stocks, they've really skyrocketed. So I think that this is one way that medicine's not going to go back to the usual way that we were before, and we're going to be able to do a lot more cases by telemedicine. Obviously, you can't do a physical exam, you can't touch a patient through telemedicine, but it will be used a lot more. The CMS changed their rules so that there should be some reimbursement. I think we're still working out whether or not the reimbursement replaces all of the revenue that we used to get from people coming to the office. And that's one of the reasons why 16,000 primary care practices have closed, because they couldn't make it financially.
Yeah.
Next question.
Yep. So you addressed this a little bit in terms of providers. The question is, how can we address the additional mental health issues arising from the isolation required by the pandemic?
I think it's a huge issue. It's a great question. I think that we really have a tremendous amount of psychological stress on almost all of us. I've been staying home since the pandemic started. I have not been to the grocery store. I have not been almost anywhere. And I think that we're really going to have to, and I'm very concerned about my fellow physicians and nurses and respiratory therapists and frontline workers who are just exhausted. And so we had a burnout problem for physicians before the pandemic. And as you probably know, suicide rates are higher in physicians than almost any other employment category. So this is a tremendous problem that I think that we really are just beginning to scratch the surface of how to respond to it.
Yep. Is it possible to tell through testing which mutation of COVID you're infected with?
Almost everybody, well, the virus can mutate. It's mutating all the time. Most of the mutations don't make any kind of change, but you can, with special testing, tell which of the mutations you have, yes.
Okay, and then there were a few questions posed this morning in a Wall Street Journal article entitled, "What are the GOP views on healthcare?" that seemed appropriate for me to pose to you. So, first question, curious what your thoughts are. Do conservatives continue fighting for a full repeal of ACA spending and taxes, or do they accept current spending as the baseline?
Well, I'm not a mind reader of what Mitch McConnell's thinking. I don't think that the Republicans are going to revisit the idea that they can repeal the Affordable Care Act. I mean, they tried that several times and failed. And certainly, if they were able to do it now, President-elect Biden would veto any bill that harmed the ACA. One of the interesting things is that healthcare, rightly or wrongly, is of more interest to Democrats than it is of Republicans. One of the problems is that Republicans have been able to articulate that they don't like the ACA, but they never really came up with a replacement plan. I mean, President Trump has said he has a replacement plan, but he's never really revealed what it was. And if you talk to people on Capitol Hill, the staffs that create these legislative issues, there's a lot more expertise on the Democratic side because Democrats are more interested in healthcare than Republicans. I think the pandemic has clearly, in some ways, made it harder to be a small government conservative because even the Republicans passed those first 3 COVID bills that had things like, sick leave for employees and payments to people. And so when you see that there probably is a need for government safety net, that makes it harder to be a small government conservative. So I don't think that if the Supreme Court rules as I think they will, I think the ACA will be the law of the land for the foreseeable future.
Two-part question. Are the vaccines 1 or 2 doses? And if 2, what's the interval between the doses?
Both the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine are 2 doses. The interval, I believe, is a month between the 2 doses. And it's important to recognize that what they're saying is you're not really protected until 7 days after the second dose. Now, J&J is trying to create a vaccine that we think is going to come on board, and they're testing a single dose. So, but so far, all of the ones that look like they're coming on board, Moderna and Pfizer, are 2 doses.
Aside from the temporary side effects you mentioned, do you have any worries there are long-term side effects from the messenger RNA vaccines, Moderna's and Pfizer's?
We don't know. And if you vaccinate 300 million people, you probably will get some serious side effects. We just don't know. And like I said, I mean, it's impressive that Pfizer has tested it on 43,000 people and Moderna has tested it on 30,000 people. But if you vaccinate millions of people, I would predict that there will be hopefully rare side effects, but we've never used this before. That doesn't, I mean, if and when the FDA approves it, I will get the vaccine because it's a risk management kind of thing that I'm 68 years old, so I'm at a high risk group just because of my male sex and my age. And so I will take the risk of getting the vaccine because one, it will help me, and two, it'll help society, but there will be a small but rare risk that I might be harmed by the vaccine.
How long after a person has had COVID can one detect that? For example, through residual antibodies in blood?
We're still trying to get a handle on that. And like the people that have long COVID, many of them don't have antibodies, and so they've never really, it's been very confusing. So we really don't know the natural history of the disease, and we're still working out how the antibody tests can actually help us.
Okay, great. So those are the questions that have been posed. We can't thank you enough, Kent, for such a thoughtful and thought-provoking presentation. And as always, we're all a little smarter because of you today. Thank you to all of our attendees who took the time to join us. And please keep a lookout for our post-webinar survey and the link to this webinar, which we will send. Have a great rest of the day and stay safe, everyone. Thank you, Kent.